The following program contains graphic images that may be disturbing. Parents are advised that these images may not be suitable for young children.
Things are about to take a weird turn. It's time to bring you the strangest stories from inside the emergency room. It's time for Bizarre in the ER. And this first story is a cautionary tale on so many levels. A 64-year-old man was cooking while under the influence. CUI, don't do it. Searching for kitchen utensils, he stumbled, fell towards the kitchen counter, pierced his eye on a pan handle. Whoa! Yeah, now you know what I'm talking about. It took a team of surgeons working over several hours to remove it. And of course, this is not something you want to remove on your own. That
he had a bad day.
Quite a visual. You do not need to be working in a hospital to realize that is not where a panhandle is supposed to go. We're now joined by ophthalmologist Dr. Boxer Wachler to talk about this. This guy, clearly they were able to remove that object. You have to ask yourself what's going on with this guy's vision afterwards.
He is the luckiest guy, right? I mean, he must have a horseshoe up his butt to come out of this with no vision loss. He did not lose any vision in the eye. He didn't lose the eye either. It just happened to miss the eye. It just happened to not spear the brain and lodge behind the throat. No vital structures there, fortunately. So there probably was an orbital floor fracture, which I'm sure they use mesh and some other materials to repair that. But he made a miraculous, amazing full recovery.
So after something like this, obviously it's a team of doctors who will carefully remove the panhandle. Never thought I'd say that. And then obviously testing the eye to make sure that certain muscles around the eye don't need to be reconstructed. How does that look for an injury like that in terms of then evaluating the patient and probably having to do some corrective surgeries after? Or this guy they took it out and, hey, what do you know? I'm good.
The report was he made a full recovery, didn't need any further surgery, went home, used that pan, and cooked eggs. No, I'm just kidding. I'm just kidding.
But sober.
The guy did something smart because despite being under the influence, he did not try to remove the object on his own. We always know if you're impaled with something, you want the professionals to try to dislodge it. Curious, in your career, what's the strangest object you've seen in the orbit?
I would say I was a resident in St. Louis, and I was called to the emergency room, and a boyfriend had just gotten this new blow dart and asked his girlfriend, hey, turn around. As a joke, blows the dart. It actually punctures the eye, goes through the eye, comes out the other side of the eye, punctures the inner part of the sinus, and lodges there, basically pinning the eye in like one position. So she's looking around, but this eye doesn't move. We were able to remove the dart, but luckily it didn't puncture any important part of the retina. It didn't hit the lens, didn't hit the cornea, and came out a part of the retina that wasn't visually functioning, essentially. So she ended up with 20/20 vision despite that injury.
But what I really want to know is what happened to the boyfriend.
I think they broke up.
Well, right afterwards, they got married. No, I don't know.
Dr. Brian, thank you, sir.
Pleasure.